Welcome to On Deck with Mercury. I'm here today with Dr. Ben Schwartz. He's the Director of the Division of Epidemiology and Population Health for Fairfax County Health Department. Dr. Schwartz, thank you for taking time out of your busy schedule to sit down with us.
Yeah, thank you for having me and having this session.
So I've got a few questions for you. I think that a lot of residents in Vienna may want to know answers to kind of feel up to date with what's going on with COVID-19 in our community. What are the symptoms of coronavirus, and what's the general progression of someone who contracts COVID-19? How are they treated? Can you speak about the possibility of using drugs created for other purposes and treating COVID-19? And how about serum antibodies from recovered individuals? Could that be an effective treatment?
So the hallmarks of COVID-19 infection are the presence of fever and cough. Some patients also will have fatigue, they'll have muscle aches, they may have some other symptoms, but really fever and cough are the two that are most important and that occur at the beginning of an illness. As the illness progresses over several days, patients may develop more severe disease. It may progress to shortness of breath or signs of a lower respiratory infection. And at that point in time, someone may need to be hospitalized. What we're finding in the US is that about anywhere between 1 in 7 and 1 in 10 people will need hospital care. The rest can be safely at home. They get the illness, they recover from the illness, and that's that. But about 1 in 7 to 1 in 10 requires hospitalization. When they go into the hospital, they get supportive care and they get respiratory care. If needed, they get put on a ventilator to help them breathe. There are a number of drugs that are being used but have not really been tested yet for effectiveness against coronavirus because this is still new. And so if one does go into the hospital, and particularly if one requires intensive care, there are drugs like hydroxychloroquine or remdesivir that may be used. But again, we don't have a lot of information at this point in time about how effective they might be. There are also new therapies, and you mentioned serum or plasma from somebody who has recovered from the infection, and that could work because after someone recovers, they have high levels of antibodies, so it's a good way of getting those protective antibodies into someone who is sick. But the ability to use this on a widespread basis is still kind of far off. But there are a number of options or possibilities that are being studied.
So talk with us about testing. There's a lot of conflicting information out there and concerns about under-testing. Is testing being limited in the Fairfax County, Vienna, Northern Virginia region, and that specific criteria must be met in order to get a test? What is the current availability of testing in our region? And will self-testing or drive-through testing be available in Fairfax County?
Yeah, there certainly has been a lot of concern in Fairfax and all over the country about the issue of testing. You know, if you develop a sore throat and you think you might have strep throat, where do you go for testing? You go to your primary care provider, your pediatrician or your internist. You may go to an urgent care center. And the problem we've had is that these places that usually do our medical tests have not been testing for COVID-19, and there are two primary reasons. One is they don't have the supplies to collect the specimens, and the second reason is that they don't have the personal protective equipment in order to feel safe while they're collecting that specimen, so they don't get sick, so they can continue providing care for others. Those barriers are slowly dropping, but still getting tests is not as easy as it should be. So what I would suggest is that if someone needs a test, they first approach their primary care provider, but then recognize that they may need to go to other locations in order to be tested, and we'll talk about what those other locations might be. The other important message is that not everybody who is sick with cough and fever needs to be tested. And so if you have cough and fever and think you have coronavirus, it is critically important that whether you get a test or not, that you stay home to avoid infecting other people. And this is one of our key messages. So throughout our conversation today, I'm going to have a limited number of key messages, and I'm going to identify them as key messages because these are the things we need everybody in our county, everybody in Vienna to do so we can slow down the spread of this virus.
So what should someone do if they believe they need a test? When does someone need to be tested? And what's the process and time frame start to finish for someone who gets tested?
So testing is available commercially. Doctors can send it to a commercial laboratory just like they send other tests to a commercial lab. But first they have to get the specimen. So call your doctor, tell your doctor your symptoms, and they may say, come in and we'll do a test. When you come into the office, you don't want to infect other people who might be there. And so hopefully they will bring you back to a room right away. But if not, cover your face, cover your mouth and nose with a cloth, just so that you won't potentially cough or sneeze or spread the infection to someone else who is in the doctor's office. The test is what's called a nasopharyngeal swab. So it's a small swab that is put into the nose, and it goes back into the back of the nose, the nasal cavity, what we call the nasopharynx. And a specimen then is put into a tube, and it's sent off to the laboratory. It may take a few days to about a week, depending on how busy the laboratory is, in order to get your result. And that result will come from your doctor. Now, if your doctor doesn't do the test in their office, they can refer you to an ANOVA respiratory clinic. So ANOVA has 3 respiratory clinics in our county, which they just started this week. And what your doctor would need to do is they would need to call the clinic, tell them that they want to send you to get the test done, talk with the clinic personnel there, and then you could go and get a drive-through test at the respiratory clinic. But it's important the doctor calls first. For those who don't have medical care, who don't have a doctor, the options are more limited. So one possibility is an urgent care center. And there also are federally qualified health centers. HealthWorks in Herndon is one place where people who don't have medical insurance can go and get enrolled on the spot, see a clinician, and then potentially get tested.
So to follow up, what about the drive-through testing possibilities?
ANOVA has just begun some respiratory clinics where if someone has a referral from their doctor, and if their doctor has called the respiratory clinic first, then they have the option for drive-through testing at that site. Others are looking at the possibility of drive-through testing, but there's not yet anything set up in our county. The health department does not do the testing because we think that it's important for clinicians to evaluate the patient and not just be there to take the swab. So the situation is still developing, but there are some options, and I think the availability of testing in multiple types of sites, whether drive-through or not drive-through, is going to be increasing.
So what happens when someone tests positive? Who's notified? What information or instructions are shared with patients and others in the larger community and the Vienna community? And will the town of Vienna receive information regarding a positive test resulting in community share? That's important for us. And is the health department still doing contact investigations?
Results of testing go from the laboratory to the physician who ordered the test, and then that physician reports back to the patient. Because of the privacy of personal health information, that information is not shared to other entities except for the health department, because we have a role in protecting the health of the public. So the health department receives information about positive tests, and after someone has already been informed by their doctor, one of our nurses from the health department will call them and talk with them about two critically important things. One is to self-isolate. And what that means is the person who is infected needs to stay at home and needs to stay away from others while they are ill, at least for 7 days and potentially longer. And that's one of those really important things to stop from spreading infection. The second thing the health department person will talk about is the need to identify and to quarantine contacts. Now, what does that mean? That means that people who are in close contact who may have picked up the infection stay at home, stay away from others for a 14-day period during which they may become sick. So isolation and quarantine are two of the mainstays of how we control the spread of infectious diseases in our community. With respect to Vienna specifically, there have been cases in Vienna just like there have been cases all across our region. But again, because of the privacy of personal medical information, that information is not shared directly with the town.
So what should someone do if they believe they have COVID-19 symptoms or have tested positive? How can they protect their family?
So I've already shared some of those messages, but it's always good to repeat, and that is that if someone believes they have COVID-19 based on having cough or fever, or if someone has a positive test, the best way they can protect their family is to stay isolated at home. Ideally, they should be in a room with the door shut. Maybe as the weather gets nicer, the windows open. They should, ideally, if one lives in a place that has more than one bathroom, have their own bathroom as well. They can be provided with meals by other family members, certainly talk on the phone, remain socially connected. But to the extent possible, they should stay away from others because they could then spread the infection.
What is the rationale behind the recommendation that those who are sick or may be exposed of quarantine for 14 days? We hear about the 14 days out in the media a lot. Who needs to be quarantined and why the 14-day period? Why is that important?
So infectious diseases have what we call an incubation period. And the incubation period is the time between when one becomes infected and when the symptoms begin. So when you get infected, the virus begins to grow, and it grows and grows and grows, and then at some point it grows up to high enough levels that it causes illness. It causes the fever, it causes the cough, and then you begin spreading the infection to other people. The reason we do quarantine is that anywhere between 2 and 14 days after acquiring the infection, those symptoms can begin. And by having someone stay at home and stay away from others during that period, during that incubation period, if or when they become infected, they are already separate from everyone else. So they will not have spread the infection. And quarantine can be remarkably effective in stopping infectious diseases. Before we had COVID, there was another coronavirus infection that came out in 2002 that was called SARS. And I know many people have heard of SARS. And there were 8,000 or so cases of SARS in the entire world. And then the infection was eradicated. And what did that was isolation and quarantine and some of these other measures we're talking about. So if these are done well, they can be effective at changing the course of the infection in our community.
So speaking about SARS being eradicated, is it possible that at some point in the future that COVID-19 could be eradicated?
Unfortunately, SARS and COVID-19 do have some critical differences.
Okay.
And one of the situations with SARS was that it didn't spread between people until a few days after symptoms began. And so that gave us enough time to identify the cases, to isolate them, to quarantine their contacts. With COVID-19, it can be transmitted around the time that symptoms begin. So it's just a much faster virus than SARS. And so I don't think we're going to put this genie back in the bottle, but we can certainly slow it down.
So what does community spread mean? We hear that phrase talked a lot about, and what are the best things Fairfax County residents can do to contain and limit the spread?
Community spread refers to the transmission of disease from person to person in our community. Early in the course of this outbreak, all of the cases that we identified in Fairfax County were among travelers. We knew that they had come from China or other countries and had brought the infection with them. Then, next, we began to see some cases occurring within families, among family contacts. So there may be a husband who gets infected, and then their wife would get infected. Now what we're seeing is we're seeing cases that don't have a travel connection, don't have a family connection, where we don't know exactly where they came from. And what that means is that they came from the interactions that we have in the community every day. And so that's what community spread means. When there is community spread, the most important thing is that the community takes action to stop that spread. And I know when we have a new disease, people often feel powerless, right? And with coronavirus, there may be people who think this pandemic is just out of control and there's nothing we can do about it. And they couldn't be more wrong. There are things we can do about it. And so let me share with you the 4 things that we all need to do to slow down this outbreak. So the first, and we've talked about it already, is isolation of people who are sick, so they don't infect others in our community. The second is quarantine of their close contacts, so that if those contacts are infected, they don't spread the infection to someone else. The third important thing that we need to do is to wash hands and not touch our face. If you get the virus on your hands, you can wash your hands and kill the virus. But even if the virus is on your hands, as long as you don't touch your eyes, your nose, or your mouth, it's not going to cause an infection. You need to get the virus into one of those so-called mucous membranes in order for the infection to occur. So wash your hands, don't touch your eyes, your nose, or your mouth. So that's the third. The fourth is social distancing. The main way this virus spreads is through respiratory droplets that are expelled when somebody coughs or sneezes. And those droplets are affected by gravity. So if I were to sneeze, the gravity would bring those droplets down out of the air. And we know that about 6 feet is a safe distance. So you and I are doing social distancing just perfectly. If you stay 6 feet away from other people, if they're sick, if they might cough or sneeze at some unpredictable time, you won't get infected. So those are the 4 things: isolation, quarantine, hand washing and don't touch your face, and social distancing. If we do those 4 things, it can be incredibly effective. So one thing that everyone needs to realize is that infectious diseases are local. What happens in New York City does not have to happen here. And if we can do a good job with those 4 things, we will slow the spread, we will blunt the curve, we'll flatten the curve of this outbreak in Fairfax County, in Virginia and in Vienna, and we can do it. We can, and we have to.
What would you anticipate for the Fairfax region, for the Vienna community over the next 2 to 3 weeks?
The number of cases is going to continue increasing. There are a lot of people who are infected out there, both those who have been tested as well as those who haven't been tested. And unfortunately, not all of them stay home when they're sick. I mentioned to you before that the health department investigates people who have positive laboratory tests. And unfortunately, some of them continued to go to work even after they had the positive test, and therefore posed a risk to their coworkers and to others out in the community. Now I know that not everybody has sick leave, and so understand some of the difficulties that individuals and families are facing. hopefully with this new bill in Congress, that risk will be mitigated.
Right.
But again, if we do what we know is right, we can slow down the spread of infection.
Okay.
So cases will increase. We know from previous pandemics, influenza pandemics primarily, that the curve, that a wave of disease in a community might last between 6 weeks and 3 months. And so how high that wave goes depends on what we do. Our goal is to make it like this, not like this.
Right.
But it may be in our community for 6 weeks, as long as 3 months.
It's been reported that we should expect cases to increase over an 8-week period. We just talked about these time frames. Why 8 weeks, and where are we on that trajectory right now?
We're still in the early part of that trajectory. The 8 weeks or so is an estimate that again comes from other pandemics. In Wuhan, China, the city where this pandemic began, their peak of disease, their wave of disease lasted about 2 months or so. So I think that's probably a pretty good estimate. And we are still early in that course, but we can make a difference.
What do you anticipate will happen whenever social distancing requirements are limited or lifted? What will prevent coronavirus from spiking in the community after the social distancing has been lifted?
Hopefully, even if the president announces that nationally we are going away from social distancing, as I mentioned, all disease is local. And so certainly we should listen to what comes from Washington, but we should also listen to what's happening in our own community and recognize that social distancing is an important part of a strategy to control the outbreak in our own community. So I hope that while we're listening to the recommendations being made by national experts, we also listen to people in our own county, people in our own town here in Vienna, and that we do what is important and what is effective at controlling the outbreak.
Speaking of social distancing, even when the requirements are lifted, is it probably a good practice anyway? I'm a handshaker and all those things. Is this something that will just be part of the fabric of our society maybe, that just this is a better way to interact post-COVID-19?
I think this may change some of our interactions as we move to the future. And as we've talked about what to expect with COVID-19, we've talked about that disease wave in the community, 8 weeks or so. We haven't talked about what might come after. And that is, we've known from other pandemics, from influenza, where we've had a series of pandemics throughout the 20th century, and then again in 2009, we know that there's not just one wave of disease. So here we are in the spring experiencing our first wave, but people need to be ready for a second wave of disease that may occur in the fall. And so we may be going through all of this all over again. So our ability to maintain those good habits, maybe to bump elbows instead of shaking hands, and to keep from touching our faces, those good habits, I think, are things that we can call on again in the future if there is another wave of this pandemic.
Does the coronavirus live on surfaces? Is there a danger of exposure to residents of the town who use our drop box, for example, and our kiosk tools that we've implemented to reduce the need for person-to-person interaction because of the experience that we're having now? We're encouraging people to go online or to call in with whatever their requests are. But now the drop box, the kiosk, is there any risk on the surfaces?
There are risks on surfaces. There was a study that was published in a prestigious medical journal just a couple weeks ago that looked at surfaces that were contaminated with the virus and how long the virus survived on that surface. Hard surfaces like steel and plastic can sustain the virus for as much as 3 days. Now, it doesn't mean that it's highly infective, and this was just an experimental study. It didn't look actually at whether people became infected or not. But what it does say is that the virus can survive on surfaces, and if you touch those surfaces, it gets on your hands. Then if you touch your eyes, your nose, your mouth, it can get into you and cause an infection. The main way the virus spreads is respiratory droplets. So it is certainly safer to use a kiosk or a drop box compared to interacting in person with a city or town employee or county employee. And the county has closed many of its buildings as well. Good practices, when you use the drop box, after you do so, if you have some hand sanitizer, use it before you get back in your car. If you don't, when you get home, wash your hands and make sure that you kill any virus that is on your hands from touching those surfaces.
Sure. And probably for our employees as well, as they touch those documents, probably after that, wash their hands as well.
Yeah, paper documents, less clear that the virus will survive on those documents, but good hand washing, frequent hand washing, those are some of the key messages that people should be aware of. Yeah.
Good. So you mentioned hard surfaces, but what about surfaces that are considered to be soft surfaces? What about those?
Yeah, the virus probably does not survive very long on cloth surfaces, and has not been shown to be transmitted in food either. And so those are some important messages, and people can feel comfortable that it's not going to get on their clothes and stay on their clothes. One of the reasons why we recommend using tissues or using your sleeve when you sneeze to cover your mouth is that the virus will not survive for a long time on those porous and soft surfaces.
Ure. So talking about the food piece, I know that carry out and delivery, takeout food has been more of the norm now. The dine-in has not been utilized. Why is it not contracted through food? Why is that the case?
Well, food handlers, first of all, have good food safety precautions that they always follow, whether we have COVID-19 or whether we don't. And so part of it is the good training and the good habits of food preparation. But it's just unlikely that the virus would be in a food it's killed by the high temperatures that you would have in cooked food. And so far we have not seen that to be a concern.
If someone is recovering from COVID-19, how can they get it, and will they now test negative?
When someone is recovering from COVID-19, the level of virus that they have in their nose and their throat goes down over time. The recommendations are that someone who has the disease should remain isolated for at least 7 days and 72 hours after the fever has ended and other symptoms have gone way down or gone away altogether. So at least 77 days plus those 72 hours at least. After one gets the infection, they develop antibodies. And so when you have COVID and recover from the infection, the high likelihood is that you are protected and will not get it again. Now, I can't say that for 100% sure because we haven't had very long experience with this virus. But if it works the way other viruses work, and so taking that scientific evidence from other respiratory viruses, we believe that immunity may be lifelong.
If coronavirus is going to be seasonal, as some medical experts expect, how do we avoid having enact such a stringent economic and damaging social distancing strategies in the future?
So unfortunately, viruses that cause pandemics may come in waves, and we're having a wave in the spring now, and there may be another wave that's going to occur in the fall. Often the second wave is larger than the first. The worst pandemic in modern history was the 1918 influenza pandemic. And there was a small wave and then a much bigger wave coming in the fall. So we have to be ready for it. And unfortunately, all of the things that we're doing now and that we need to do even better, we may have to do again in the fall. We'll see. Hopefully that won't occur, but we do need to be ready. We do need to be aware of what may occur.
Can the 12 to 18-month timetable for the vaccine be accelerated in some way?
In making vaccines, it's important that they are tested thoroughly to make sure that they are safe. Because vaccines are given to people who are well, not to people who are ill.
Oh, that's a good point.
The safety of a vaccine is critically important. So once we have a candidate vaccine, once we have the science down, then we need to do testing to make sure the vaccine is both safe and effective. That testing may take about a year, maybe a little bit longer. So I know that the scientists are going to accelerate things as much as they can, but we need to make sure that a vaccine is both safe and effective and need to go through those scientific studies in order to do so.
Thanks for answering all these questions. I know a lot of questions. Is there anything that you want to leave with the residents of Vienna to think about with regard to COVID-19 and how it impacts them?
So let me just share two final thoughts. So one is just the amazing work that our community service providers are doing at this time. We know that there are incredible needs in our communities, that people need food, they need assistance. As people are out of work, the economic situation is going to affect their lives in many ways. And I know our community volunteer organizations are doing a really amazing job. I know our school system is doing an amazing job delivering meals. So where children would get breakfast and lunch at school, now those meals can be delivered to them. So I would just like to recognize the work that these organizations, that neighbors are doing for each other at this stressful time. And so I think that's important. The other thing I'd like to do is just once again reiterate those 4 things that all of us in our community need to do. So isolate if you're sick, quarantine, stay home if you're the contact of someone who's sick, wash your hands and don't touch your eyes, nose, and mouth, and socially distance. And so with that, I think we can make a difference in our community. And hopefully this is something we can all do together.
Thank you very much. Thank you for your partnership with us and working with us over the last couple of weeks in our emergency management meetings and getting information to us. And I would shake your hand and thank you here, but we're social distancing, so I'll wave or something. Yeah. But thank you for, I know you're a very busy person right now, and so I really appreciate you taking time to sit down with us.
Well, thank you. It's always good to have an opportunity to communicate with leadership like with you and also with the people of Vienna.
Sure, absolutely. Thank you for watching. We hope that this has been very informational for you and helpful to the Vienna community. For more information on this topic, go to viennava.gov/coronavirus. And please monitor and watch all of our social media outlets where we will be putting out information about this topic. We hope everyone stays safe. Thank you very much.